So I started my first company at 30 as a single mom with 2 dying parents at the time, which in retrospect was nuts. But you know how it is when you're an entrepreneur and you see it so clearly that you can't not do it. So I did that. I partnered with just an unbelievable world-class team of interventional cardiologists around Florida, and we did that for 10 years, and our premise was to bring more research into their communities, their hospitals, but also to conduct our own research because we wanted to understand our elderly patient population in Florida, and that was not something that was currently being done. So there was a real heartfelt effort among the physicians to, we need to do better because I want to know how I'm going to treat the 85-year-old that still, he looks like a 60-year-old. He's playing, golf 5 days a week. And I don't know. I don't have the research. So we built a homegrown registry. So that was my first foray. We grew the business every year. I found a niche rather working with pharma companies in early stage, like phase 2 research. Had a CEO that I had worked with early in my career recruit me to a portfolio company that had large physician group, a Medicare Advantage plan, an ACO, and I got to really understand what population health was. How are we going to transition our current operational model to these value-based care reimbursement models? And I loved it. I thought I knew a lot of things in healthcare by then, but I didn't know squat till I tried to do that. And then where I ended up and what took me to the dark side, Nathan, which is technology, was I don't have the tools I need. This is inadequate. I'm going to go over there and try to influence what they're building. And boy, was that when I got exposed to product development, all the things we could build. I was just enamored. I'm going to change the world. But with my experience, these smart minds. So that's how I got stuck.